We have several options approved in lung cancer patients second line. There we have three immunotherapy agents. We have three immunotherapy agents, nivolumab, pembrolizumab, and atezolizumab. As I mentioned before, because of the active Crohn's disease in this patient, I would be very reluctant giving her immunotherapy because of increased risk of immune-related adverse events, which could be pneumonitis, colitis, dermatitis, thyroiditis, hypophysitis, myocarditis. The other drug which has been approved in second-line therapy because it showed improved survival compared to best supportive care would be docetaxel. So for this patient, I would consider docetaxel second line. Or another correct answer for all of those patients who we treat with cancer is always clinical trials. If this patient didn't have an active Crohn's disease, if she had a history of Crohn's disease which was in remission, then my desire to use immunotherapy treatments for her would be a little bit easier to make, even though we still know that patients with connective tissue disorders in remission has about 20% chance of having immune-related adverse events, but I think in this situation it will make me more comfortable using that options. We don't have any randomized clinical trials comparing three immunotherapy agents I mentioned. So at this point, the selection is based on a physician's habit, based on a patient preferences. There is different schedule for those agents. Nivolumab is given every 2 weeks. Pembrolizumab and atezolizumab is given every 3 weeks. There is no efficacy differential, in my view, between those three agents. There is a lot of new developments ongoing in first-line therapy. Just a couple of days ago, we had the release of a Checkmate 227 telling us that the study met its co-primary endpoint of improving progression-free survival in the newly diagnosed patients with high tumor mutational burden. So in the future, maybe we will have a new biomarker for patient selection for immunotherapy, and tumor mutational burden could be emerging as one of those new biomarkers.